My name is Kim Smith. I am the coordinator of March of Dimes Canada Polio program and your facilitator for today's Ask the Expert session. Today, July 31st, 2023, we have a great topic, being a powerful self-advocate. You have more power than you think. Learn what it takes to help yourself be heard. Our speakers from March of Dimes Canada's own team will answer your questions about advocating for yourself and others. Join us today to learn what advocacy means. Hint, it's not all protesting and placards. How to identify decision makers in everyday life and steps to leverage your own story to advocate for issues that matter to you. By the end of this session, you'll have the tools you need to effectively advocate for yourself and others in daily life. We have two great guest speakers today. Tshuma brings extensive experience to his work as an advocacy specialist at March of Dimes Canada. Before joining us, Gift was an access advisor at McGill University's Office for Students with Disabilities, where he ensured that students got the academic accommodations they needed. He's also a disability rights activist, an accessibility consultant, and co-founder of Accessibilize Montreal, a grassroots organization that advocates for disability rights and to improve transit accessibility in Montreal. Gift enjoys composing and playing music in his free time. And we also have today Sasha Elford, advocate for an inclusive barrier-free society as March of Dimes Canada's National Manager of Public Affairs. With nearly a decade in the nonprofit sector, Sasha has worked in advocacy, communications, and volunteer management. Before joining us, she worked on issues of gender equality and gender-based violence at Interval House, Girl Guides of Canada, and Feminasco in her free time. In her free time, Sasha loves getting out in nature, dabbling with photography, and cooking vegetarian food. Without further ado, I would love to introduce to you Gift and Sasha.
Hi, everybody. Thanks so much, Kim, for the wonderful introduction. And thank you, everybody, for having us here today. We're really excited to be here. I'm going to kick us off, but before I do that, Gift, I don't know if you want to just chime in and say hi. I always feel weird if I just forge ahead.
Yeah, thank you. Hi, everyone. So good to be part of this discussion. Thank you for joining and also for having us. And I'll pass on the mic to Sasha to kick us off, and I'll join in a few moments.
Sounds good. All right, so like Kim said, today we're going to be talking about being a powerful self-advocate. And to go over what we're going to be covering, we're going to be talking about how we can all advocate for ourselves. So this includes how to advocate effectively, how we can influence decision makers, but also who are those decision makers that we might want to be influencing. And we're also going to talk about using your personal story to advocate. So, you know, we all have a story, and it can be a really powerful tool for advocating and getting our point across. We'll also at the end be sharing some of March of Dimes Canada's own advocacy resources that are available. So these might be of interest to many of you who are joining us today. So we'll share some information about that at the end as well, in case you are interested in continuing your advocacy journey. So first off today, we're going to start by talking about what is advocacy. I'm sure we all have an idea of what it means, but I think it's important that we're all on the same page before we get started, so that we have a shared understanding of what it means to advocate. And I'm willing to bet that everyone here is an advocate, even if you don't necessarily think of yourself as one. And I know that it's called Ask an Expert today, and Gift and I are the advocacy experts. But I think probably everyone on this call is an advocacy expert. Everyone is probably advocating very regularly in your lives. And so I'm sure that there's lots that many of us can learn from you as well. But we're going to share some tools and tricks and ideas for being even more effective as advocates. So this is the definition of advocacy that we're going to be using today. And before I get into that, I just want to say that advocacy can mean different things to different people. It is personal. But I want to share a definition because we're going to be breaking down this definition over the course of our presentation. So the key parts are bolded on the slide. Advocacy is telling a story to a decision maker with the purpose of influencing that person to do or not do something. So like I said, we're going to spend the rest of the presentation breaking down what those three bolded parts mean. So telling a story, decision maker, and influencing, not necessarily in that order, but we are going to talk about each of those different sections. But first, I'm going to pass it over to Gift to talk a little bit about why we advocate at March of Dimes Canada.
All right, thank you. Why do we advocate at March of Dimes Canada? Well, we are considered to be a leading service provider, resource, and advocate for people with disabilities. And our main vision, it's a vision of an inclusive, barrier-free society for people with disabilities. Isn't really quite a reality to us yet. And to get there, we are going to need to advocate. And because of this, we advocate on many different issues, including some of the ones I'm mentioning here, like financial security, accessibility, independence at home, and also within the community, and access to care services as well. All right, so next slide, we're going to launch a poll, and this poll is for you to let us know how often do you personally advocate, whether it's for yourself or others. Is it daily? Is it weekly? Is it monthly or never? So you should see something pop up on your screen in a moment. So just select one. Okay. Do we have everyone's votes in? Are they in yet? I don't know if you see them on your side, Sasha. Oh, there we go. We got them in. Okay, so the results have popped up for the poll. I don't know if everyone can see, but it looks like most people advocate on a daily basis. Okay, so 35% of you seem to advocate on a daily basis, and that's very indicative of how important it is to be equipped with the skills to do advocacy in an effective way. Okay, next slide. Sasha, I'm going to hand this next to you.
Great, thanks. And yeah, it seems like many of you, even if it's not daily, many of you it's weekly or monthly, with only a few of you saying that you don't really ever advocate. So hoping we can build up the confidence for those of you who maybe aren't advocating very much right now. But for the rest of you, it's great that you're here as well, because you are clearly needing to do this on a regular basis. So going back to our definition, the first part that we're going to focus on is that idea of the decision maker. So if it's telling a story to a decision maker to influence them, let's start by talking about, who are those decision makers? So a decision maker is any individual or institution that's in a position to take actions or make decisions on issues that impact an individual or society. So really, it's anyone who is in that position to impact your life or to impact society on a larger scale. So there's lots of different decision makers that you might encounter. And sometimes when we think about decision makers, we might think about government or, CEOs, leaders who have a lot of power, and absolutely, those are decision makers. But there are also more everyday decision makers that you probably are encountering all the time. So some examples of some of the decision makers that you might come across, healthcare providers are probably a big one. They can, make decisions about your care or help you to access different programs and services. So they can be someone that you need to advocate to. Service providers, so different organizations that you are served by, the people working there have, the ability to impact you, and so you might need to advocate to them. Government officials or elected officials who represent us, like I said before, those are some of the big ones that we often think about because they set the laws and policies for whether it's your municipality or province or territory or Canada. So those are some big ones. But there's also people like employers. So if you are employed or if you're looking to be employed, those could be some decision makers that you need to influence. Teachers, if you're in school or if you have a child who's in school, they can make decisions that impact your everyday life. And even family members or caregivers could be decision makers because they might be making decisions either on your behalf or maybe on behalf of the family, and maybe you need to advocate to them because you have an opinion about how things should go and you want to be able to influence them. So just to be clear that sometimes it's just these sort of everyday interactions that can be advocacy. It doesn't always need to be, like Kim said at the outset, a protest or that sort of thing. It could be as simple as a conversation with a family member where maybe you need to advocate. So when you are advocating, it's really important that you're reaching the right decision makers. So particularly with some of those decision makers that maybe you don't know personally, so whether that's in government or in an organization or within an institution, it's important to remember that just because someone is powerful or influential, it doesn't necessarily mean that they are the person that can make the change that you want to see. So to make sure that you're reaching the right person, you need to do your research. And so this could look like maybe doing some Googling or web searching to find out, who is the right person, maybe looking at an organizational chart or reading an organization's website to try and figure out, who is the person here that's actually going to be able to make this change for me. If you are advocating to government, then you need to think about jurisdiction. So what that means is who's responsible for the area that you're talking about. So if this is something that is an issue about, for example, an income support program like the Ontario Disability Support Program, well, that's a provincial issue. So you're going to want to reach out to the provincial government, not the federal government or the municipal. So just thinking about making sure that you're reaching the right people who are actually going to be able to make that change for you. We're going to move on to the next part of our definition, and I'm going to pass it back to Gift to talk about influencing.
All right. So once you have identified the decision maker or the decision makers, you want to make sure that you are influencing that person to do something or not to do something, depending what that issue is. So being influential, the goal of advocacy is to influence the decision maker. So how can we be most effective when we're being influential? Well, we need to make sure that it's a relationship-based interaction. We need to make sure that what we're bringing up is within reason. Are we rational? Are we formulating our ideas in a reasonable way? Is it evidence-backed, meaning is there any stats or research behind what you are bringing up? And is it collaborative? Is this a one-person army, or is this something that's within a community and you're all collectively trying to influence a decision maker on a very specific issue? So I'm going to go through all of these 4 points in more detail in this next slide. Okay, so relationship-based. So what does that look like in practice? It means that you assume good intentions, and that there's no they against us or me against them, but you're going there with really good intentions and hoping for collaborative results, and that you are offering assistance, and also is there anything you can do to help the decision maker as well with whatever issues are on their table as well. Reasonable. All right, next slide. Well, that's like working within the bounds of what's realistic and possible. So when your advocacy is reasonable, it means you are basically making sure that it's possible and which within the realistic framework. And you understand that the decision maker may have other priorities other than the ones that you're bringing in. And that also they don't have full control of every issue. There may be some constraints that they're dealing with, and that's beyond their control. And also they're dealing with many, many issues other than the ones that you may have just brought up. And also it's really important to try to be, pragmatic by thinking about what is most doable for them and consider if you can make any trade-offs. So what is absolutely essential for you to achieve and what is a nice to have? So you need to kind of weigh those two things out and see what sort of trade-offs you can do. And then evidence-backed, sorry. So do you have any data and other evidence from either Stats Canada or any news articles you may have read, or even your own personal story? Your own personal story is very, very powerful. And this could be, something that can be seen as a form of evidence if it's your own personal story, especially if you have actually documented the proof and you're showing the issue you are talking about. And the evidence basically should prove the problem and solution you are proposing to them. And then collaborative. I love this one a lot. With many voices, you are able to cover greater distances. And many voices saying the same thing is actually more compelling. It gives a lot of weight to the issue, and it also gives a lot of urgency as well to the matter. When other people are also speaking to the same issue, it's actually showing to the decision maker that this is not an issue that is being faced by one person, but it's an issue that is being faced by a community of people, and it's something that needs to be taken care of as soon as possible. So that's why it's really important when you're collaborating to find people who can be allies and who can work with you, as there are strength in numbers. So for example, with like disability related movements and issues, it's really important to get allies with you, even if they don't necessarily identify as having a disability, but as long as they are with you and they're on board on the issues that you're advocating for, then it will help, certainly. And I'll pass on the telling a story component to Sasha.
Great. So the last part of their advocacy definition that we're going to talk about is that storytelling. And Gift was talking about that in being influential, as well as how powerful your story is. So we're going to talk a little bit about how you can use your story to advocate. So first, before we get into this section, we just want to remind you that you are the expert in this particular area. No one else is more of an expert on your story than you. So I think sometimes it can be intimidating going into, particularly if it's a decision maker that maybe you don't know as well, or maybe who is, more powerful. You might want to, you might feel a little bit intimidated, but remember that again, you're the expert here, not them, on what's happened to you and what you need. And so I think that is a really important first step before you start telling your story. They might know about a lot of different things, but they are not going to know as many details about this issue as you are. So keep that in mind first. So as we know, there's always, if a story is a good story, it has sort of a beginning, middle, and an end. And so when we're talking about using our stories for advocacy, your story should include the challenge that you faced. So, what were you experiencing? What was the issue? The choice that you made and why. So, what action did you need to take? What did you need to do? Why did you need to do that? And the outcome of that decision or choice that you made and what you learned from that. And so this is really important so that they really understand both the external factors of, what was happening, what was the context, what did you do, and why has this had an impact on you? And presumably, if you're advocating, it's probably maybe there's been a negative impact. There's a problem. That's why you're there. So you're really explaining, maybe you had to make a bad decision because it was the only one available to you, and it's had a negative impact on your life, and you want to show that to the decision maker. And just a note that your story in this situation is not your autobiography. So it's not your full life story. Usually a decision maker might be pretty busy, so you're going to want to keep it focused on the issue at hand and really think if you can sort of in your mind break it down into these three categories: the challenge, the choice, the outcome. And that'll help you keep it really focused on, what you're trying to get across to them and what you're hoping to change. So once you can tell that part of your story, you're going to want to think about connecting it to the bigger picture. So like Gift was saying in that last point about being collaborative, you don't want to necessarily make this seem like it's an isolated issue. You, as much as you can, if you can show how this is having a bigger impact beyond just you, it's going to be so much more influential. So think about connecting your story to two different things, and one is community. So how are others in your community facing the same challenges and having to make similar choices and probably have similar outcomes as you? So making it clear that this is not just me, there are others, there are many of us that are experiencing this. And then you're also going to want to connect your story to a sense of urgency. So what will the future look like if we fail to act? So if they don't make the change that you are asking for, and other people are forced to make these same choices and have these same negative outcomes, what is that going to look like for our community? Is there going to be a much bigger issue that we're facing then? Probably. You know, these two questions you might not always have an answer to them if the issue that you're advocating on is a very personal one. It is very individual to you. But it's a good exercise to ask yourself the questions in case you can make these connections. And if you can't, that's okay. But we want to get you thinking about it in case it's something that that you can do to make your advocacy even more influential. So once you've thought about how you're going to present your story, you can start to develop an ask. What is an ask? It's basically, what are you asking for? So when you're advocating, yes, you have a problem. Yes, you have a story to share, but then what do you want them to do? What is the decision maker supposed to do for you? Because of what I talked about earlier, about needing to be, or what Gift talked about earlier, about needing to be reasonable and understand other constraints, it's important to prioritize in your advocacy. So you might have a list of 10 things that you want the decision maker to do when you walk into a meeting with them. But it's really important to prioritize, and ideally, if you can, have one ask. So you're going in, you're telling a clear story, and then you're asking for one thing. What can they do to change this? And this is honestly the best protection from no, from the decision maker saying, no, I can't help you with that, or from having a lot of delay. If you go in and you have this long list of 10 things, it's going to be really easy for them to say that, you know, that's a lot, I can't do all of that right now. Or maybe they're going to pick the easiest thing off of the list, and maybe that's not going to be the thing that has the biggest impact on you. So really thinking about it beforehand and prioritizing and trying to pick out one thing that is a clear action they can take. And it doesn't mean that you can't follow up later if you have that list. You know, maybe once they've done item number 1, maybe that's a great time to go back to them and start talking about item number 2. But just thinking about how you're presenting it is going to make you much more effective if you can start with one. And then finally, how you actually present this. So the messaging, when you go into that meeting, how are you actually going to deliver all of this, your story and your ask? So you want to be, as much as you can, try to keep your messages short and direct. You want to present a clear problem, that's the story that you put together, and solution, that's the ask that you decided on. And you want to make sure that it is tailored to the decision maker. So it's very likely that a decision maker is busy and your issue might be really complicated. So rather than getting weighed down in all the details and trying to make sure that they really, you know, understand everything, just making sure that you present that clear problem, that clear solution, that you're doing the things Gift talked about, like having evidence to back it up, sharing your story to really make it real for them. That is going to go so far in really making sure that they hear what you're saying. And when it comes to tailoring it to them, you want to think about, you know, how are they best going to hear the information? So if you know them already, you might have a sense of how they prefer to communicate. Are they a numbers person? Are they a more touchy-feely kind of person who gets into their emotions? So thinking about if you can present it in a way that's going to sort of work the best for them. And also, if you know anything about what their priorities are or what they're interested in, trying to ensure that you're connecting what you're sharing with them back to those interests and priorities that they have. So that's basically how to make sure that your messages are really compelling when you're advocating. And I'll pass it back to Gift to take us through some of our final content.
All right, so now that you've received all these strategies and on how to advocate for yourself or for your community. I want you to leave with this today. I want you to think about an issue you are facing or a community of you are facing. Okay, so think about what is the issue. Once you thought about what the issue is, think about who are the decision makers or the decision maker in this situation. Okay, and then once you've thought about the issue, think about what is your story. As you heard from Sasha, storytelling is very, very powerful and it's very relatable too, right? So it's really important to have a good story that ties into the big issue. And lastly is, what exactly are you asking, right? So use this simple checklist when you're starting to plan out your advocacy, and it would help you kind of structure things and use your energy and time more effectively as you go about with advocating for yourself or advocating for a group of people within your network. And next slide. If you'd like to learn more about being a self-advocate, we offer a number of resources specifically for people with disabilities and their families and caregivers. Some of these resources are available in our website at marchofdimes.ca. You can check the self-advocacy toolkit, which is on our next slide. And this one is free. It's a free resource that's available on our website and anyone can access it. And this toolkit is meant to be self-guided. So you can click through whatever is relevant for you whenever you're free. And it really covers a lot of topics that we discussed today and even more of the topics that we may have not touched upon today. And also another cool thing within the self-advocacy toolkit is we have templates and worksheets that you can use that would help guide you in your advocacy. So for example, how to prepare a speech or how do you write an effective email. So we have templates for those as well that you can work off of. Yeah, it's under our advocacy page on marchofdimes.ca website. And you can look at there. And then another resource that I'd like to talk to you about is our Disability Advocacy Network. And this network, basically, it's a national network across the country that is aimed at building your advocacy skills. It helps for you to speak out on issues that are impacting the disability community. And once you are part of the Disability Advocacy Network, sometimes we refer to it as DAN, you will get access to our virtual workshops, and you'll also get access to our monthly newsletter, which is sent only via email. And then you'll also get info on our advocacy campaigns and any other resources or events that may be coming down. And at the moment, in terms of workshops, we are actually offering both self-advocacy and political advocacy workshops. So if you're interested, just check out our website for more info on that. And that's pretty much it. And if you'd like to get in touch with us, just send us an email at advocacy@marchofdimes.ca, or you can simply just visit our website, marchofdimes.ca/disability advocacy network. If you can't remember what it was called, just go on Google and just type in March of Dimes Dan. It's gonna pop up and it's gonna lead you right there. Now we should be ready for some questions if you have any.
Thank you, Gift and Sasha. What a great presentation. Really enjoyed it, and I'm sure that the group also really enjoyed it. Thank you so much for your presentation. We are going into questions and answers. We have some questions in the chat, and if you have any that you would like addressed, please type them into the chat and we will get to them. Just before we go, like, I'm gonna ask all the questions that are in the chat, but if it's specific to your own situation, you may want to reach out to your after stroke coordinator to get details. This is a general discussion, so Gift and Sasha will do their best to answer. So first question is how to get a psychoeducational assessment for a university student in Ontario for free. I don't know if you guys can comment on that.
For free, it's kind of hard to get one for free, but I would say maybe get in touch with your home care and community services in Ontario, and they'll be able to refer you to a psychologist who can do the assessment for you for school. And sometimes within the school, whether it's university or college, they have an office for students with disabilities. So you can reach out to them and see if they may have like resources of where you can get an assessment. They usually have quite a bit of resources around that, even if they're not the ones conducting the assessment themselves.
Thank you. Thank you, Gift. And another question, who at March of Dimes Canada is advocating for stroke survivors and what are the issues?
That's a great question. So the team that Gift and I are part of, which is called the Public Affairs team, is responsible for all of these sort of organizational level advocacy across March of Dimes Canada. So like Gift had shared, we advocate on some of the big picture issues that really are going to touch all the different folks that March of Dimes Canada serves. So that includes stroke survivors, as well as people with, diverse disabilities. And so some of the issues that we're advocating on are things like financial security. We know that this is something that touches, pretty much all the groups that we serve. That is such a, a foundational issue that if somebody doesn't have, a livable income, it's really hard to live a good, healthy, independent life because it affects pretty much every area of your life. So we've been doing a lot of advocacy on the Canada Disability Benefit, which is a new federal income support benefit expected in late 2024 or early 2025 that we see as having enormous potential for offering more financial security for folks with diverse disabilities, including those living with the impacts of stroke and brain injury. So that is something that we've been focusing a lot on. But outside of that, we have many different issues that we talk about, including things like accessibility. Often there's different accessibility consultations going on across the country, and we try to make sure that we're representing, again, the diversity of the voices of folks that we serve and the different accessibility needs that they might have, as well as, supporting our colleagues who work in the different program areas when there are opportunities to expand our services, expand our programs. We can advocate to government to try and, make more of those services available for folks. And outside of that, we also talk a lot about independence at home in the community, like Gift was talking about. And so that can look like advocating for, greater access to care, especially home and community-based care that meets people's needs and allows them to stay in their own homes. Sometimes advocating for home modifications that enable people to stay independently in their homes. So sort of a broad range of issues, but we really try and look, holistically as an organization serving many different diverse groups to look at the types of issues that are really going to affect many, many different communities that we serve.
Wonderful. Thank you, Sasha. Suzanne Smith-Bailey chimed in here. I don't know if everybody can see it in the question and answer, but she does say Suzanne is the national manager here at March Dimes for afterstroke and professional practice. And she says our afterstroke teams across Canada advocate in each of their provinces and at a wide range of committees across health and community care. From our frontline staff to all of the managers, directors, and vice presidents, all take part in advocacy initiatives in their province. So thank you.
Yeah, thanks for adding that, Suzanne, because while the public affairs team does sort of the organizational level big priorities, then of course our afterstroke team plays a huge role in advancing the afterstroke program and the interests of folks that we serve with who are living with the impact of stroke in many different places. And so it's collaborative in that way.
Thank you very much. And there was a question there that says they needed more financial help, but I think you touched on that. I don't know if you want to touch any more, but I believe that you already did answer that question as well.
I can add a little bit more. I would say that, you know, like I was saying, we are really committed to advocating to ensure that people have more access to financial benefits, including the Canada Disability benefit, but also we really want to make sure that people take advantage of the existing programs and benefits that might be available to you. So I would really encourage you to check out the disability tax credit, which I know many people may feel is not helpful for them if they're not working, but it can be a really incredible credit for opening up additional benefits. So we really encourage people to pursue the disability tax credit because it is worth it, even if you're not in an employment situation. And we don't know what the Canada Disability benefit is going to look like yet, but we do know that having the disability tax credit is likely to make it easier to get that new federal benefit. So we're definitely encouraging everyone to file their taxes, and if they can, apply for the disability tax credit over the next year, because we think that that is just going to make it much easier for you to get the new federal Canada Disability benefit when it does become available.
Great, thank you, Sasha. We have quite a few more questions here coming up. That's great. Love to see them. What makes advocacy difficult for me is getting my thoughts on paper. It's hard with brain injury. I don't know if you can comment on that.
Yeah, I think what I would recommend, I don't know if you use your smartphone often, but what I find useful is to record my thoughts. So depending on the type of phone you have, there's usually like a recording app in there. I know on the iPhone it's called Voice Memo. I don't know what it's called on other phones, but look for a recording app and just record your thoughts, whatever they are, and then put them in paper later on when you play back your recording. At least you're able to record everything that you have in mind, and you won't forget it. I find that quite useful.
Thank you. We have a question coming up about your slide and whether or not they have the points correct, but just to let you know, as anybody who's registered for the session will receive the slides after the event. So I'll be emailing those out to you. So the question was, tell your story to advocate. It listed 3 points. Your story should include challenge, but what were the next 2 points? I wrote down the other 2 points, choice and outcome. Is this correct?
Yeah.
Fantastic.
Perfect. Well done. And yeah, we will be sending the slide presentation out after. Suzanne mentioned as well, we're always seeking funding opportunities to expand services, cover the cost of increased staff, and ultimately explore sustainable health system funding. So that is good too. Bruce, another question here. I am chair of the Stroke Survivors Advocacy Group of Canada and wish to know what national initiatives March Dimes Canada is doing countrywide.
So is that with regard to advocacy and our advocacy priorities?
Yeah, I think so. I think you may have already answered this question. I don't know if you want to comment a little bit more.
I can add a little bit more. One of the things that we most recently are working on is with the Canada Disability Benefit regulations. So like I mentioned, we are advocating in favor of this benefit and wanting to get it to people as quickly as possible. And one of the big opportunities for that over the next year is that the federal government is going to be consulting on the regulations. And so these are essentially the rules that will decide what the benefit looks like. So who is going to be eligible? How much will it be? How often will the payments be? What do you need to do to keep the benefit over time? So all these different important questions. And we really want to ensure that the voices of folks that we serve are part of that conversation. The federal government has committed to co-creating those regulations or rules with the disability community. And so if anyone is interested in contributing their thoughts and being part of those conversations, and sharing, what stroke survivors specifically would need from the Canada Disability Benefit. You can get in touch with us at the email address that Gift shared, and we'll make sure that you get on our list so that you can be part of having input into that process. The other thing that I would encourage you all to check out is our Benefit Without Barriers report that we recently launched. This is a new report that we shared with the federal government, all about ensuring that the Canada Disability Benefit is fully accessible. So we want to make sure that, yes, it's great to have a new benefit, but if no one can access it, if it's really hard and challenging and full of barriers, then there might as well not be a new benefit. So we spoke with many people with disabilities, caregivers, different organizations across the country to help create that report. And we launched it back in May. And so that's been a pretty big advocacy initiative for us recently that I'm sure many people on this call may have actually been part of those discussions, but really excited to share that that report has been released and it's been shared with the federal government as well.
Perfect, thank you. Another question as it relates to stroke survivors and their needs. Is there specific advocacy provincially? Do you partner with coalitions that may be providing advocacy? For example, in BC, they have a coalition called BC Health Coalition.
Yes, so a lot of the work that we do provincially is in partnership with our different program leads. So like Suzanne had shared in the chat before, March of Dimes has, our different program leadership in different regions across the country. So a lot of the times we will work with them on issues that are provincial specific, and see if there's opportunities to join different coalitions. So for example, in Manitoba right now, there's a provincial election that's coming up this fall. And so we have signed on to the Manitoba Disability Matters Vote campaign, which is essentially trying to put forward different disability issues, including better access to healthcare for people with disabilities in the province. So that's one example. In Ontario, we're part of the Ontario Community Support Association, as well as the Accessible Housing Network. So advocating on home and community-based care and also accessible housing. So a lot of the times we are part of these different groups to help push forward different local issues and partnering with the people that we have on the ground working for March of Dimes in the different regions as well.
Thank you, Sasha. We have time for a few more questions. If your question didn't get answered today and you still have a question, you can email me and I will get the questions over to Sasha and Gift and get an answer for you. Here's a question. What do you do when you're trying to advocate for yourself and your healthcare provider railroads you into saying you have a totally different problem you don't have, rather than the addressing the problem that you're advocating, asking yourself for?
That's a really good question. And I see Gift and you're unmuting yourself too.
No,
Do you want to?
No, I wanted to, if they could repeat the question again, just to see if I understand correctly. Yeah.
I think the question is, if you're in a position where you're advocating for yourself, you're asking for help from your healthcare provider, but your healthcare provider sees it differently and doesn't agree with you and suggests it's a different way.
Yeah.
Yeah.
Yes, go ahead if you have thoughts.
Yeah. I mean, that's bound to happen, and I can even speak to that as a person with a disability as well. I would say ask folks within the community, within the disability community as well, if they have other resources of, let's say, different OT who they can recommend, who may have a different perspective on the issue. I find people within the disability community are very, very resourceful. So I would suggest going through there and see if we can connect with another healthcare professional who can understand you better, if that makes sense.
Yeah, and just adding to that, if for whatever reason, you need to work with this provider, or there's not, you're having trouble finding someone else, it could be also helpful to go back to the idea of sharing the outcome with them. So really making it clear, when I say this and you say that, this is the outcome for me, and this is the negative impact that it has on me. Of course, we can't necessarily control how the decision maker or the healthcare provider is going to receive what we're saying, but we can do our best to try and get our point across and have them hear, really what the impact is. And so I would say that that's another strategy that you might want to consider as well, is just making it really clear to them what impact they're having on you. If you feel that, that you are being, railroaded or blocked, like you were saying.
Thank you guys for answering those questions. How new is the disability benefit mentioned? How to get on the email list you mentioned recently for barriers?
Yes, so you can email us at advocacy@marchofdimes.ca, and that's on the very last slide. So you'll get that when Kim sends out the slides to everyone. You'll have the email address that you can contact. And the new Canada Disability Benefit is expected in either very late 2024 or January 2025. We don't have a specific date right now, but that's sort of the best estimate that we have based on how long the timelines are with the federal government. But we're advocating that it, is as soon as possible, because we know that many people could really benefit from that new benefit.
Thank you. What about advocating for stroke best practices, especially in rural communities?
Could we elaborate a bit more on the question?
I guess in rural communities, what about advocating for people who have had a stroke? Like, how do they advocate for themselves in rural communities? I guess that's the question.
Okay. Yeah, I would say yes, it's definitely, there are particular challenges depending on where you might be located. I think that's where, being able to tap into virtual networks is really helpful. So, clearly you're part of, a virtual network if you're joining today's webinar. And I think, finding, again, as much as it might be a little bit more sparsely populated, there may be fewer resources, there may be fewer allies locally, being able to tap into folks online who are maybe sharing similar challenges and being able to come together around some of these issues is really impactful, because, you know, perhaps in your community there's not that many other people, but maybe if you're in Northern Ontario, for example, perhaps there's people all across Northern Ontario that you can connect with. And that's where the Disability Advocacy Network is also really, you know, as it grows, we're really trying to build that sense of community, so that people can connect on some of these shared issues that they might have. So if that's something that you're, you know, looking to do, I would definitely encourage you to join our network, and maybe you can connect with others who are also, you know, in a rural community and wanting to address those issues as well.
Thank you. We have 2 more questions that I'm going to try to quickly get in here with last minute we have. My son has severe aphasia and is right side paralyzed. How can he record his thoughts, questions, etc.? Tools or suggestions?
If any ideas there,
Yeah.
you're the tech expert.
Yes. Again, the voice memo app or any recording app within an iPad or cell phone or even on the computer is best. I would say if you want something that can transcribe his thoughts, is to look at a web platform called Otter, OTTER. So you can type in otter.ai, and what that does is it transcribes everything you are saying, everything that you're recording. So that could be another way to put into words his thoughts and ideas. Hope that's useful.
Thank you very much. Do you connect people who need help filing taxes?
So we don't provide direct support for taxes, but I would encourage you to check out on the Canada Revenue Agency website. There is a list of free tax clinics every year, and they have includes listings specifically where they will support folks with disabilities or accessibility needs, and that's all free help that's provided by volunteers. And I would also encourage you to check out Disability Alliance BC. Some of their services are only for British Columbia, but some are available nationally, and they do provide assistance for folks who need help filing taxes. So those are 2 resources I would encourage you to check out.
Thank you. I'm going to share my screen for a moment. Thank you for attending today's session. If you would like further information on your current situation, please reach out to your active stroke coordinator. And if you don't have one, you can reach out to the information navigator through our stroke line or by email in our website. So I'm going to be providing this slide as well to everybody who registered. So if you have any questions about other March Dimes programs or anything like that, please do reach out. And if you have a question that wasn't answered today, please let me know and I'll get them over to Gift and Sasha. Thank you everybody for attending today's Ask the Expert session, and have a great day.
Thanks everybody.